and welcome to MCure AICUG TV, live from Bhubaneswar on rightdoctor.com. I'm pleased to have with me the senior consultant from Pune, Dr. Parag Beniwale. Sir is an expert in adolescent healthcare. He is recently written a book on gynecological manual on adolescent girl and young. So thank you very much for joining us on MCure AICUG TV. So let me begin with the first question about adolescent health. How different is the adolescent health from the adult health?
Right. Basically, adolescent population is different from adults. So they are neither children nor adults. So you have to handle them with care. They are very, very sensitive. I would say that their minds are fragile. So you cannot treat them like children. They want them to be treated like adults. But then they don't have that kind of a maturity of an adult. So whenever you are dealing with adolescent health, we have to be very particular, we have to be sensitive, we should not be judgmental because that is something which creates a barrier between an adolescent client and ourselves.
So is there any specific age that defines, because I think there is a variation about adolescent age category and neither they are falling into the age where they can get consultation from a pediatrician or from the physician.
Right.
So what is the age criteria that we follow in India?
The age group is 13, if you ask the definition, the age group is 13 to 19.
Right.
But then there are some areas where it is an extension into young adults where people up to the age of 25 are included. But technically adolescence is up to 19.
So what are the different issues like medical issues or I would say some health issues that do come across in this population?
Right. Adolescent basically is a wide spectrum. So any disease that can bother an adult will bother an adolescent. So the basic adolescent problem in our country is related to nutrition. Because of our faulty dietary practice, we are seeing a lot of anemias. So almost it is presumed that almost 90% of adolescent girls are anemic and almost 80% of adolescent boys are anemic, which is a shocking revelation. Second problem regarding nutrition is obesity. Because of our changed dietary habits where adolescents are consuming a lot of unhealthy foods or the so-called junk foods, and lack of exercise is something which is contributing to obesity. So these are the two major issues which bother adolescents. The second big area is sexuality. Adolescents are getting exposed to sexuality very, very early. A lot of them become sexually active at an early age. They are not well aware about contraceptives, so this results in an unwanted, unexpected pregnancy. They don't know how to deal with it, they don't know where to go, and they land up with problems related to abortion. In fact, there are some adolescents who do face a challenge of septic abortions as a result of unsafe abortion. So these are the two major areas. Of course, there's a big group of married adolescents. Though the legal age of marriage in our country is 18 years for girls, there are states like Rajasthan and Uttar Pradesh where girls are married off at the age of 16 and 17. And these are the girls who become pregnant, and once they become pregnant, they face a lot of problems because they are short-statured, they are nutritionally poor, they are anemic. These are the girls who are more likely to have hypertension, and that could be really a serious problem because a combination of anemia and hypertension would make them prone for a lot of problems in the pregnancy and especially after childbirth. Again, these are the girls who would land up with cesarean sections because their pelvis is not ready for a birth.
It's really a concern, I see.
Absolutely.
I think we are on the spectrum of two ends, wherein on one side it's a nutrition which is poor nutrition, and on the other side it's a very high nutrition which lands up in the obesity. And on the other side we have the sexual health related issues like in this category of the population. Sir, what are those preventive measures that are currently being practiced by national bodies or at the level of doctors during their clinical practice? What are those preventive measures that we do follow in India?
So before I go to preventive measures, I would just like to add that one more problem that has come up is substance abuse. There are a lot of adolescents who are exposed to alcohol, they are exposed to smoking, and they end up having substance abuse, and this is so rampant in many colleges. There are some music festivals where drugs are sold, that's what people say. But then these are the things which bother adolescents, because adolescents are vulnerable. They don't understand what is right and what is wrong, and if you try and tell them that what you are doing is right, they are put off. Right? So you have to handle these adolescents very, very carefully. Coming to preventive measures, Foxy has been proactive in this field. Way back in 2006, we joined hands with Government of India, we joined hands with the WHO, and then we sensitized a lot of doctors for adolescent-friendly health services. In fact, I was one of the first ones to be sensitized in this. And then we passed on the baton to a lot more gynecologists, where a lot more gynecologists were trained in how to handle adolescents, how to deal with their mentality, how to deal with problems related to them. And Government of India is very much proactive in this phase. There are a lot of adolescent-friendly health clinics all around the country. It is estimated that more than 7,000 such centers are existent in government centers, in PHCs and in hospitals, where there are specific times where adolescents are catered. Then there are more than 700 counselors all over the country. Now this number is very, very small, but they do have an important role to play when they are dealing with adolescents. Because some situations they can handle more sensitively rather than the clinicians. So these are the major things that are happening, and the government has recently started a national program for Kishore Swasthya Yojana. So actually Kishore Swasthya Yojana is something which has come up in a big way for last 4 years, where they are dealing with all sorts of issues related to adolescents. And there are two specific interventions which are being planned. Something called weekly iron folic acid supplementation, where adolescent girls and even adolescent boys, in school girls, out of school girls are included in this. They are provided weekly supplements of iron and folic acid. So this reduces the burden of daily intake of tablets, so the compliance is better on part of the adolescents, because when we are dealing with adolescents, it is important that they follow what you tell them. So looking at this particular program, it is possible and it is easily implementable that a girl or a boy that age group takes iron folic acid tablet once a week. So this would definitely prevent nutritional anemias. And the second thing that has been tried, especially in rural areas, is the management of menstrual hygiene. So there have been places now, even if you refer to any newspapers or ads, you can note that there are vending machines for sanitary napkins available in public places. So that is something which also has been promoted by the government for the last 3 to 4 years. That is being implemented.
Fantastic, sir. Very happy to know the various activities that are conducted by Foxy, the biggest national body for obstetrician and gynecologists, and your contribution for their various programs that are run by the Foxy. Just a note to add that we at MQR are also the leaders in anemia management, and we also do a lot of patient-centric programs. And yes, recently last year we did one Limca record activity where we have mapped the anemia detection scams we did, near about 16,470 pricks we did, and it's a record wherein we have mapped the anemia in various category, adolescent as well as male, female and the pediatric population. And it's very concerned to know that the anemia is one of the most important nutritional concern in our country. And there is a long way to go. Thank you very much for joining us on MQR TV. And what would be that one key message that you would like to just give, a one-liner message to all the audience, all the doctors who have arrived here in beautiful city of Bhubaneswar?
I would just tell them that adolescents are special. You have to handle them with care. Don't be judgmental. Don't get into the parental mode. Just be the clinician that you are and try and help them medically.
Thank you so much.